If you're enrolling in a Medicare Part D prescription drug plan, here's 3 things I want you to remember. First and most importantly, when you are choosing a plan, and I may be stating the obvious, but you need to find a plan where all your drugs are covered by that drug plan's formulary. Formulary is just a fancy word for drug list. Why is this so important? In 2025, there's a $2,000 cap that you can spend on copays, and if your drug is not included in that drug's plan, then that cost of the medication is above and beyond that $2,000 cap, and that's going to come out of your pocket. Second, even if your drug is in the plan's formulary, there are 2 things you need to know about. That drug may require prior authorization. So in other words, your doctor may have to help you get that medication covered, and the plan may require step therapy for that particular medication. Step therapy basically means that you may have to try some different medications or less expensive medications before they're willing to provide the medication you're requesting. And point number 3, I want to tell you a story. So I was helping a new client. She's only on 3 medications, but 2 of them are complicated medications, expensive, step therapy required, prior authorization required. So when I went into my software, and I always look to see what comes out on top. That's typically the most cost-effective plan. And when I did that, it was the plan that was most cost-effective. But when we got into the weeds and we looked at the details, we could see that the drugs required step therapy for one of them. One of them required prior authorization. And there was a concern because she had just started the new medication that required step therapy. So what I did is I looked a little further down on the list, and if she was willing to spend an additional $200 for the year, she was able to enroll in a plan where there was no prior authorization required, there was no step therapy required, and all her medications were in the formulary. So what I want you to understand here is that, yes, typically I tell you the best way to go is go with the most cost effective. But when you are dealing with a situation that may be complicated because of the medications, don't stop at just looking the most cost effective plan. Look a little further, and that little extra cost may be worth avoiding the aggravation of having to take these extra steps to get your medication covered.